All right. I do have the top of the hour, so to be respectful of people's time, I will go ahead and get started here. So thank you again, everyone, for joining us today on the Introduction and Application Clinic webinar. My name is Kale Wozinski, and I'm a telehealth and outreach coordinator here at the center. If you haven't done so already, will you please put your name, title, and organization into the chat box? It helps us get a feel of who is on today's webinar. This webinar is being recorded and will be posted to the website following the completion of the event today. I'm going to go ahead and put a copy of the slides into the chat box. Please let me know if you have any trouble accessing it and I can help troubleshoot it with you. Now, we do encourage discussion. You can do so by utilizing the chat box or unmuting your line. We do ask, however, that if you are not actively speaking, to keep yourself on mute so that we can cut down on feedback. Now I will turn it over to Kim to kick us off today.
Thanks, Caleb. It is great to see each of you today. We are very glad that you are able to attend this webinar as we explain more about the Delta Region Community Health Systems Development Program, specifically our application and eligibility webinar for clinics. So we're very excited to have you all. So you can see our agenda today. I will be with you for the first little bit, and then I'll turn it over to some other speakers, so you won't have me the entire time. And we'll show you a video as well. But as Caleb mentioned, if there's any questions or comments that come up, feel free to use that chat. Feel free to unmute. We want it to be as conversational as possible. We are recording this presentation, so if you have others that you feel would benefit from this presentation at a later date, you will be able to share it. So we'll jump to the next slide. So the National Rural Health Resource Center is a nonprofit organization dedicated to sustaining and improving healthcare in rural communities. The center is the TA provider for the Delta Region Community Health Systems Development Program. The center is committed to diversity, equity, and inclusion, and anti-racism, and building a culture where that difference is valued. And we have more about this on our website, where you can learn more about that commitment. The Delta Region Community Health Systems Development Program, which is a mouthful, which we abbreviate to DRCHSD, or we also just shorten it to the Delta Program. All of those are the same thing, but we are funded by the Federal Office of Rural Health Policy in collaboration with the Delta Regional Authority. And it is my pleasure to introduce Suzanne Snyder. Suzanne serves as a public health analyst at the Federal Office of Rural Health Policy and the DRCHSD Program Officer. And Suzanne will explain a little bit more about the eligibility and application process. Suzanne?
Yeah, thanks, Kim. Appreciate it. And it's wonderful to be here. I just want to personally welcome y'all to this webinar to learn more about the program. And just thank you for your interest and the time that you're taking to join us today. It's a really unique program. Extensive resources and intensive TA that you would receive as a participant. So it's quite a commitment, but really hope that you really consider this opportunity to join. So when it comes to eligibility, eligible applicants for the Delta program, as you can see on the screen here, include small rural hospitals, so both PPS facilities and critical access hospitals, rural health clinics and other standalone clinics and other healthcare organizations that are located in the 252 designated DRA counties and parishes are also eligible for this program. So this slide gives you a view of who we've served thus far, and this is including folks who have graduated from the program as well as currently participating organizations. So typically we bring on about 10 facilities every year in what we kind of call cohorts, and they start the 3-year participation cycle, meaning that we're working with about 3 cohorts at any given time, or about 30 organizations. So since 2017, as you can see, we've served 54 organizations altogether. That is indicative of 52 communities across the Delta, and all 8 Delta states have been served. So the folks we've served thus far include about 45 hospitals, and then we have 6 clinics and 3 FQHCs that we've served. If you're not sure if your organization is eligible, then I'd encourage you to reach out to the folks at the center because they can help you to clarify that status. And if we look at the next slide, if after today, after you've heard everything about the program, you feel ready to take the next step and apply to become a participant in the program, then you can submit an application using the center's online application on their website. Applications are accepted on an open and a rolling basis. So you can submit an application at any time in the year, and your application will remain on file, and eligible organizations are considered for future openings as well. After your application is submitted, the center schedules a review call to kind of get to know you, get to know your organization, answer questions that you might have, and get a sense of where you're at right now to confirm that you can fully commit to all aspects of the program, but also just to help make sure that this program is really the best fit for you and that there might not be other programs that are a better fit. So if you're interested, I'd highly encourage you to apply sooner rather than later so that you can be considered for our next cohort beginning program activities this winter. And with that, I will pass it over to Latrell Courtney.
Thank you, Suzanne, and good morning, everyone, and thank you for joining us. I'm going to talk a little bit more about the program's purpose and goals. So the purpose of the Delta program is to help providers develop a local continuum of care to participate in and benefit from value-based care, such as preparing for population health and sustaining access to local healthcare services. Working with inspired leadership, developing innovative collaborative efforts, and having access to forward-thinking technical assistance, the DRCHSD program helps rural healthcare organizations continue to deliver care in the face of overwhelming adversity. We will work with our team, invest in business consultants on how to improve your financial, operational, and quality performance. Utilize telehealth to improve patient access to services. You will focus on leadership development and workforce needs and prepare your organization for the future. Build connections and create community infrastructure to advance rural health and develop your community care coordination plan. Lean on program staff and peers for shared expertise, resources, and explore how organizations are successfully navigating the healthcare environment. And you please note that you will need to be actively engaged in meetings and all program goals. This is a comprehensive program and it's not a la carte. To meet the unique needs of clinics participating in the program, the clinics receive a phased-in approach that delivers technical assistance, which we refer to as TA, in a stepwise manner to build on knowledge gain and ensure readiness for effective participation in the program. We will cover these areas in the following slide. So this is a very high-level overview of each clinic phase. We will guide you through the consultation process to complete each phase. The 3 phases are, phase 1 is the clinic business office and financial assessment. Phase 2 is the clinic business office functionality and revenue cycle assessment. And then the phase 3 is the clinic operations assessment. Phase 1 will take place entirely in a virtual environment. After all the data has been submitted by the HCO and the analysis occurs, a report review and action planning session will take place virtually. And then for phase 2 and phase 3, it will be initiated through an on-site interview and observations when the consultants will come out to your on-site. And after those interviews and analysis, and a report and action plan session will occur also virtually. And I also know that after each phase is completed, a review call will take place to determine whether the action plans have been implemented and if you should move forward to the next phase. The consultants work with each clinic to create an action plan during those phases, and those action plans are developed based on what the consultants have observed during their time with the clinic staff, observing the clinic processes and the data review. And after the progress is made with the action plan, that's when you would then move to the next phase. Following completion of phase 3, an IT readiness assessment is initiated as a next step. The clinic should demonstrate readiness by completing an evaluation of the technology IT processes. The assessment look at IT infrastructure and deficiencies to support telehealth implementation. For example, this could include network, broadband services and connectivity, analytic monitoring capabilities, optimization, and policies and procedures. Identified IT readiness deficiencies must be resolved prior to initiating the full telehealth assessment and planning to benefit program services. Hospitals and clinics both receive a comprehensive assessment with turnkey services to help leaders implement and or expand telehealth services. The services can be tailored to organizations' telehealth needs and support financial system enhancement. Since the program's inception, hospitals and clinics have both received nearly $3.5 million to enhance telehealth equipment and systems. The program has assisted organizations with developing 36 new telehealth services and 18 telehealth expansions. Some common telehealth service development projects include chronic care management, dermatology, emergency department, endocrinology, home health and remote monitoring, inpatient unit rounding, neurology, primary care, psychology, radiology, and stroke. We have one clinic, urgent and primary care of Clarksdale in Clarksdale, Mississippi. There are a 2020, there will be a graduate this year. They started in cohort 2020. They received telehealth equipment and technical support in system selection, workflow, and policies and procedures to help leaders successfully launch a new telehealth service. UPCC is now providing primary care services to their county jail via telehealth. Consultation services include regularly scheduled review calls to evaluate progress and determine resource and TA needs to further assist the clinic leaders. Review calls support implementation of recommendations that are critical for next steps. Hard stops may be incorporated to support the implementation of key recommendations and allow for adjustment of services to better fit the clinic's needs. I'm now going to pass it to Selena to finish out the presentation.
Thank you so much, Latrell, and good morning to our guests. Happy that you guys are here. I am now going to cover some areas in addition that typically will follow some of those phases that Latrell just covered for us. One additional critical component of the DELTA program's approach, hiring of the community champion and the initiation of the community care coordination planning will begin after the clinic demonstrates readiness. And so readiness can happen in between those different phases, or readiness may occur after completion of phases 1 through 4. The champion is a critical component of the DELTA program's approach for community care coordination, planning, and sustainability. Participating organizations receive $8,875 per program quarter to support the hiring and sustaining this position through the program cycle. The champion is either contracted or a half-time employee of the clinic. Champions act as liaisons to support the clinic's community engagement goals and facilitate the development of a sustainable community care coordination plan while under the direction of leadership. Other responsibilities are highlighted here on the slide, so they are also assisting their clinic with fostering community relations, generating community buy-in, performing the outreach activities, promoting services, and helping to build patient and family loyalty. The center does provide professional, you can go back to the previous slide. Thanks. The center will provide professional development and one-on-one coaching to assist that champion in building their capacity for community care coordination planning. Next slide, please. Community care coordination planning supports leaders with developing a local system of care. This helps to improve transitions of care, patient experience, and engagement. It helps to provide satisfaction that impacts operations and financial viability of the clinic. Sustaining a community care coordination plan involves intimately engaging with either current or new community joint partners to establish accountability for its health outcomes. Program services for community care coordination program goals includes community champion hiring assistant, which I just covered, facilitating in-person community events, as well as action planning workshops, funding support for community outreach and educational activities, and community action plan implementation technical assistance. So moving on to another program goal area, fostering workforce and leadership development. Data suggests that there is a positive relationship between employee engagement, customer satisfaction, and business outcomes. The program provides various services, as you can see here, to help leaders to address workforce needs, build staff's morale and knowledge level, and enhance recruitment and retention of providers. Next slide. In addition to the program goal areas, we also host a convening annually in the Delta region. And this is our Delta Annual Summit, which is focused to highlight program success from participating sites, facilitate learning and professional development, as well as foster networking opportunities with peers. Federal office representatives are in attendance, as well as DRA and center staff. The program supports up to 4 members from the clinic to attend. 2 are required, which would be the clinic owner or administrator, as well as the champion. Throughout the program, there are additional virtual trainings and webinars that are hosted based off of the needs of each of the sites. This infographic is just a quick fact sheet so you can see some program outcomes. So since the program's inception in 2017, 70% of our organizations have improved financial performance following the completion of the program cycle. 54 of our organizations have received over 250 financial, operational, and quality improvement projects. I also want to highlight that 41 new service lines and 22 service expansions have resulted from the program's TA. We have had the opportunity to work with sites to develop new service lines, which include pulmonary rehab services, outpatient behavioral health, as well as cardiology. Just to highlight some of our workforce and leadership engagement opportunities, we have facilitated over 45 employee engagement assessments with additional support for staff development. And a personal favorite of mine, because this is my program area, is the support for our community champion. Over $900,000 has been dedicated to support these organizations since the inception of the program. We wanted to make sure to highlight some of the specific benefits of participation for our clinics. By participating in the Delta program, just to highlight a few, our clinics have been able to secure access to local services. It helps to position the clinic for a better future and improving the clinic's business operations and fiscal health, to highlight a few. We want to also just highlight some of the organization's success. We know it's important that we can only give so much to the testimonials of our organizations, but we do create spotlight videos so that we can highlight the success from your peers. I'm going to pause and let this video play.
I feel like our original mission was to make sick people better. And now we are looking at things with a different mindset. What can we do to keep you well?
Some people believe that once they've been diagnosed with a condition, that they're just going to have to live with that condition and there's not much they can do about it, except for go to the doctor and be prescribed more medicine. This is what this is doing, is hopefully leading them to a healthier lifestyle where they aren't so dependent on medication and that they can learn how to balance medication with healthy lifestyle choices.
Our big focus is preventative services at this point, because if we can treat things and get them under control before they are a problem, it is so much easier to promote overall wellness and to longer lives for people, versus if we're trying to respond to a problem that's already there.
So transitional care and care coordination has really helped our patients and our community become healthier and more compliant in their chronic illnesses. And overall, that has changed a lot of what we see on the clinical side for admissions and visits.
We've had several months now where we've had no readmissions to our ER. So it's been a drastic change, and I think mostly that is due to keeping in touch with the patient, giving them a resource that they can count on, and just letting them know that there's somebody here if they need them.
I think what the Delta program did was it brought me together with people I would have never worked with. Until we were brought together and identify those needs, we didn't know how we could work together. So I really think it just helped identify some of those common goals.
The center kind of pushed and prodded to think outside of the box of those normal people who you would normally see at the table. And so we have to reach across those lines. It has to be partners that aren't the traditional partners, because more people play a role in health than healthcare itself.
We have local banks, presidents and vice presidents on our committee. We have media people on our committee. I think you need all those personalities. I think in a small community, everyone has a different skill set and everybody has a different reach. And so I think it's important to pull all of those people together.
The more leaders that you have and the more joint partners you can bring to the table, the further your ideas can go and the more that you can help the community.
We have the same social and economic issues, housing, transportation issues among some of them. And if we work together, we can help create a county that can address these better than one hospital trying to do it alone.
So I'm from this community, and it's important to me that my family and friends have the resources that they need, that they don't have to drive 30 minutes north or south to the nearest hospital. They have everything that they need right here, and they can be confident in the things that we have here.
Our community members of DuQuoin are definitely healthier because of the transitional care and the care coordination that we're providing at their hometown hospital. I feel like it is one of the best things that we can offer. It meets our mission and our vision and what we're working towards. We really just want a healthier population overall.
So the communications toolkit was very essential for me in just starting the whole process of Community Champion, because I needed help with that. I needed to know how to effectively reach out and get the response that I wanted. Honestly, Delta has taken me from, this kind of scared, introverted person into a world of having to be more extroverted and having to really put myself out there and make my voice heard. I feel like I have that insight, and I also have the tools, the communication tools, to help me along the way too.
Anybody that's in healthcare knows that it's ever changing, and there's always something new on the horizon that you need to change and adapt for. So the Delta program helped us grow financially to be more sustainable in those areas so that we can adapt in the future. The Delta program gives us a chance to kind of see those evaluations through, and then the implementation and the assessments on the back end. That fresh set of eyes for us has been invaluable.
The Delta team has been absolutely amazing throughout this whole process.
The Delta program has helped us evolve absolutely.
If other hospitals have the chance to take part in this, don't deny it. Take advantage of that. It's so amazing, and there's such great help.
It just makes you appreciate what you can do in a small town like this, and you don't have to go to the city to get what you need. You can get it all right here.
Just knowing that we are helping people be healthier, I think that's the greatest feedback of all.
All right, shout out to our cohort 2019 healthcare organizations that were featured in that video. We're always excited to share the outcomes of the program and the great work that's happening in the Delta through this wonderful opportunity with DRA and 4HIP. So what are the next steps? We hope you submit an online application. Once we receive your application, the process will include us scheduling a 60-minute call to hold an application review call to finalize the process. The purpose of that review call is to provide leaders an opportunity to ask any questions. We also cover the services in more detail. And then the call helps us to kind of get to know a little bit more about your organization and what you have for strategic visions and how this program could best support you. And then it also reduces the application process burden. The information is then aggregated and submitted to DRA and 4HIP for consideration in the final selection. Just highlighting that the application deadline for cohort 2023 is October 15th. This means that the cohort will start in January, but we do make selections in December. Next slide. We encourage you to watch a few videos to gain a better understanding of how the program can assist you. So please visit our website, and this also will be, the presentation will be sent as well as a PDF, so you can also click on the hyperlinks here. The program provides a comprehensive approach to patient-centered care performance improvement, access to care, system development, and population health readiness. We're happy to answer any questions that you may have at this time. And I'm not sure, Caleb, if you're sharing screens, if you could stop sharing the screen. I like to see faces and talk to people. Okay, so I see that there is a question in the chat. Examples of community partners. So the Delta program, we use the term community partners. Some folks may say key stakeholders in the community. And so those are the same. We define our community partners as those that are really the gatekeepers of the community, that is connected to the residents of the community. So that may be our faith-based organizations, that could be EMS, nursing home, school board, schools, those different multidisciplinary folks that have a touch into the community. So not just the health providers, but social service providers too. Great question. What other questions? This is your time to ask us anything. And Suzanne is here too. So if we can't answer, Suzanne can answer. How about what service areas are most intriguing to you? What service areas are most intriguing to you about the Delta program? Feel free to use the chat as well. Or what might be most beneficial to the clinics that you guys represent, or the clinics that you work with, and your community? what might be most beneficial.
Looks like we got another question in the chat. It says,
Okay.
has the program ever been used to help facilitate a food pantry for patients who are lacking in those resources?
Oh, that's a great question. So food pantries are another community joint partner that often visit with us when we have our community events and community workshops. We have the food pantries have been used in several ways. That's another way to perform outreach to meet the community where they are. We have worked with our organizations to use food pantries to perform health assessments. So that's to the degree that the food pantries have been used. Does that answer your question, Rhonda? Tabitha Stone, the ITAs. I'm not sure what we miss here. Okay, so Rhonda says yes, we need a food pantry in our area as we do not have one at the time. So just to also kind of describe a little bit more about our process, we are the facilitators of these community events and workshops. So we are not the experts in the community. We don't go into the community saying, hey, you guys, this is what you're going to do. We support the conversations. So it really depends on what the community partners determine. So for example, if there's conversation around, we do need a food pantry, that may be selected as a priority area. And we help the folks in the room create an action plan. Okay, it's been identified that this is something that we're lacking, that we need. Let's create an action plan to determine how are we going to create this resource for our community. Who's going to be involved? So the center staff only facilitates that process, and we help the champion to keep moving the implementation plan along. So that could come up as a need. It really depends on the community that we're working with. You're welcome, Rhonda. And Rhonda, where's your community? If you don't mind sharing. Okay, Mississippi, okay. We have worked with several healthcare organizations in Mississippi. Tippah County was a part of our, Tippah Hospital was a part of our first cohort. We have worked with Sharkey as well. So Rhonda, oh, sorry, Chandra is asking, is it predetermined about how many hospitals versus clinics will be awarded? No, we do not predetermine that number. It really is a process that we get our applications, we go through the review calls, we really, it is a competitive process. And then we take our recommendations to DRA and FORHIP and we make a collaborative decision, but a certain number is not necessarily predetermined. We typically, as a collective, will choose between 10, maybe 11 healthcare organizations for a cohort. So that would be the total number, but we don't break that down to how many hospitals, how many clinics, how many FQHCs. It's a great question. Would anyone like to share what you are currently doing that could be further leveraged by participating in the Delta program? All right. Well, if there are any additional questions that come up following today's meeting, please feel free to reach out to us. We're always happy to chat. And Caleb, if you could share the last few slides. All right, yes, and there is our contact information. We are always happy to answer any additional questions for you. And we appreciate your time today.
Thank you all.